Hey guys, so it's been a little while since I've done a vlog, I guess. um, whew, it is hot out today. I cannot believe it. It has been so cold the last few days and rainy and bleh. And sorry, I just thought there was someone at the door. And today it is 20, but it feels like 25 with the humidex. And yet it was like really cold this morning when I left for work. Well, not really cold, but it was cool. I think it was only 10 out when I left for work this morning. And so when I saw that it was supposed to get up to 20, I was like, what should I wear to work? So, I mean, in the morning I was freezing, so I wore a sweater, like a long sleeve shirt with a hoodie, and by the afternoon I was boiling. So I've changed into a short sleeve shirt, and I'm out of breath because when I got home from work, I just thought it was so beautiful out that I'd enjoy it and just go for a little walk to the corner to the post office to mail something. Some people bought some baby clothes, and someone else is interested, and so I went to get to find out how much shipping would be and whatever. But I didn't realize that it was up to 25 with the humidex now. And so now I find it a little too hot out there. And so between that and my walk, whew, I am out of breath. So I'm sorry I look like crap. I'm kind of sweaty, and my hair looks gross because it's my shower. I'm going to have a shower in a minute. So I just wanted to quickly tell you guys what's going on in regards to my health right now. And so on Monday after work, I went to my regular rheumatologist, not the lupus clinic rheumatologist, but my regular one. And I haven't seen her in a few months. And I actually wasn't even sure if I should follow up with her, but the lupus clinic had said to still go and see her because they weren't sure if I would be discharged from the clinic or not, depending on whether or not I have lupus, which is like, okay. But anyways, so I went to see her, but I'm going to the lupus clinic next Tuesday, or I guess I could say this coming Tuesday. But anyways, what happened when I went to see her is, I told her about Riley. Riley is needing one of my doll's Halloween costumes that hasn't been put on her yet. I don't know if you can see. What are you doing? I know it's soft and squishy. Oh my. I don't know if you saw that, but anyways, so I just kind of filled her in. She had a letter from the lupus clinic first off that she kind of went over. And as it turns out, she actually worked at the lupus clinic at one point. And she said that most of the rheumatologists at Sunnybrook Hospital have actually gone through Toronto Western's lupus clinic at some point. And which I guess really shouldn't surprise me because, like, the lupus clinic is really well known for teaching rheumatologists about lupus. So it kind of makes me feel a little bit better about seeing the rheumatologists at Sunnybrook because obviously they know what they're doing too. With that said, I just, I let her know what was going on with me. I let her know, that I left my full-time job. I'm working part-time now. I let her know that the part-time job has helped my fatigue a little bit, which she thought was good. She thought it was a good choice that I made. She said that she usually tries to recommend to patients either, switching to an easier job to handle or less hours or whatever. So she was happy that I was able to do that. Because she said even if lupus goes into a remission, so to say, or, your blood work kind of like normals out, that the fatigue seems to be a constant problem with lupus or any autoimmune diseases. So she said really like the fatigue is something that never seems to really go away. Huh, how nice to hear. But so she said it's really good if you can, manage it, because I let her know that I was getting depressed because I wasn't able to do things that I liked to do outside of work because I was so exhausted all the time. Anyways, I then let her know about my big toe not having any feeling since May. And of course, it is only a small part of my big toe. And she thinks part of it has to do with the fact that there's like a really big callus around the area, near the area that's numb. Although I did try to tell her that it's mostly the area above where the callus is. But anyway, so she did the lovely checking of my nerves around that area with poking me with a needle. How fun that was. It really hurt in the spots that I had feeling. And it really did confirm that I have no feeling in the spot that I thought I had no feeling, because I did not feel that poke at all. She's not concerned though, because it's such a small area. And it's there's no ulcers or anything. But she said, if it was to travel or get worse, then, she might be more concerned about like nerve damage or something. But as for right now, there's no problem with that. So then, I basically, we went over what the lupus clinic had said. And first off, she agrees with them stopping my Fortic, so that was good to hear. She thought that it was a good thing for them to do, and she explained to me why she thinks they did it. And she says basically what she thinks is that they stopped the Myfortic, which if any of you aren't sure what Myfortic is, it's pretty much the equivalent to Cellcept. It's basically the same medication, only it's a coated pill, whereas Cellcept is uncoated. So it's pretty much Cellcept. But it's a different brand called Myfortic, and it's a coated pill. She said the reason she thinks they did it is to see if my kidneys start to flare up again when I'm off of it, as well as any other inflammation or things in my body. So as someone, I think one of you guys out there had commented that maybe the Myfortic was keeping things calm even in my blood work, and that was how they weren't coming up with lupus. And I think from what I got from it, that's kind of what she was saying too. So she's saying, when I go back and see them, I've been off of it for a few months now, and, I guess they're going to, want to test me for everything again to see if anything is coming back up in my tests, so that they can figure out what's going on. Then I asked her, why would they be questioning the lupus diagnosis? And she said that basically what it is she went back and looked at all the blood work that my original rheumatologist, Dr. Cohen, had done, the one that diagnosed me with lupus. And she looked at all the blood work for lupus, and she said that pretty much all of them were positive. But they were borderline positive. She's like, they were literally right on the borderline. It wasn't like a really strong positive, but it wasn't exactly a negative either. It was like almost right in the middle between the two. So because it wasn't like a strong positive, that's why the lupus clinic is kind of like, questioning it. So we'll see what happens with that next week. She gave me the option of waiting until next week to get blood work done at Toronto Western, or getting some done this week so that there was some kind of results in front of them when I meet them, which I kind of thought was the better option, even though Sunnybrook Hospital's blood lab, like most of the nurses there or technicians there, are horrible in terms of giving blood work. They have a difficult time finding my vein as usual, and sometimes I get poked like 3 times before they get me, and it hurts. They're rough, and she even admitted that. Toronto Western, it's a nun who does it, and she is amazing. Like the first time I went and I got blood work with her, did not feel a thing. I did not feel a thing. And she did like 18 vials of blood. And she found my vein right away. It was awesome. So she's excellent. And it's always been like that since then, too. So she was saying that if the kidney stuff comes up again, that the lupus clinic detects like kidney stuff coming up again, she thinks that they will most likely then want to do a kidney biopsy. Not something I'm looking forward to having done. I really hope it doesn't come to that. Sorry, there's like something in my eye. Or maybe it's just dry eye. Yeah. I really don't want a kidney biopsy. I remember back when I was first diagnosed, they were talking about possibly having to do one, and I had read up on exactly how it works and what, how it's done, and it's, it's like a day surgery kind of thing. Like you have to be put under for it, and then I think you have to be off work for 2 or 3 days. Don't really want to miss work, especially since I haven't been working here very long. So, yeah. Something that surprised me though, my breathing has been bothering me a lot, like shortness of breath again. And the walk, like where I work, the hospital is literally like a 20-minute walk from where I work. It's just down the street. Like it's literally at the, at the end of their street. But it's a 20-minute walk, and there's 2 sections where there's big hills or semi-big hills. And I remember the first time I tried walking it, I was pushing the stroller with Jillian, and we were going to catch the bus to go to one of her classes, which I haven't gone that way ever since. I guess it was warmer that day, and I was pushing a stroller, and so I was very winded that day and hot and sweaty. But this time I actually did okay because I wasn't in a hurry. I wasn't rushing. I had time. And I paced myself, and I took breaks if I needed to. And I actually managed to do it with not too much shortness of breath. I was quite tired when I got there, but I managed to do it. I don't think I would do it every time, but it kind of made more sense to me to walk it than take 3 buses that would basically be backtracking to get there. Anyways, so that's the latest. I really hope we get some answers next week at the clinic, and I really hope I don't have to have a kidney biopsy. Yeah. Anyways, that's it. There's really, I don't think there's really anything else that we talked about or accomplished. So that's it, guys. I will see you in the next video. Bye.